Hi, my name is Geoffrey Abraskin. I'm a doctor of physical therapy, and I'm going to talk to you a little bit today about what an occupational therapist does and what occupational therapy is. Occupational therapy is a rehabilitation approach to help people who have limitations or alterations in physical or mental abilities to regain life skills. Similar to physical therapy, there are a few key differences. Occupational therapy helps people of all ages improve skills needed to perform everyday tasks such as washing, dressing, meal planning and preparation, handwriting, and others, to name a few. Occupational therapy interventions include exercises for strengthening, activity tolerance, coordination and balance, adaptive equipment training, adaptive technique training, and recommendations for modifications to routine or environment for increased independence and safety. Some of the other differences between physical therapy and occupational therapy include physical therapy focusing more on the gross motor aspects of your rehabilitation, where occupational therapy will focus on the fine motor tasks, such as zipping a coat, buttoning a blouse, or handwriting. Some potential diagnoses or disorders that could require occupational therapy intervention include individuals with physical, mental, and developmental disabilities such as heart disease, respiratory disease, stroke, fractures, cerebral palsy, brain injury, spinal cord injury, repetitive stress injury, Parkinson's disease, among many others. Occupational therapy works with the patient's physician in the development of the treatment plan and goals, as well as informing the patient's physician of the patient's progress and status at the time of discharge from services, and recommendations if needed for further supports. Some different focus areas of occupational therapy include training and education for safety and energy conservation with individuals' daily routines, to prevent falls and fatigue during routine tasks, as well as many others. Occupational therapy provides education and training with breathing techniques, with exertion for decreased shortness of breath, with activity. Occupational therapy trains individuals in balance strategies and exercises for strengthening to enable them to safely return to independence with daily routine activities. Occupational therapists also teach adaptive equipment techniques to regain skills for those who have lost that physical ability. An example of increased function after a treatment or a full episode of occupational therapy would include a patient who had suffered a stroke with total loss of function of their arm and leg may now be independent with washing, dressing, toileting, and using one-handed techniques and balance strategies. That was a general introduction into occupational therapy. We covered a few key features in regards to treatment and examination. Please make sure to consult your physician or another local occupational therapist prior to initiating a treatment plan. Thanks for watching.